I'd like to call the meeting to order. The Board of Leavenworth County Commission. I'd like to invite everyone to stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. For the record, all three commissioners are present. We'd like to open the meeting with public comment. Anyone from the public wishing to speak, please come forward, state your name and address. Seeing none, we'll move on to administrative business. Mark, do you have any administrative business this time?
I will be asking the board to amend the agenda to include an executive session at the end of the meeting today for attorney-client privilege.
Okay. Anything else this time?
I don't have anything else.
All right. We'll move on. Has commissioners had a chance to look at the minutes?
I have. Make a motion to approve the minutes as stated.
Second.
I don't see anything.
Voting?
Aye.
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 Have you looked at the agenda for next week,
Yes.
Commissioner?
I have. Motion to approve.
Second.
Voting?
Aye.
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 Okay. I have some OCBs.
I move
Motion
approval.
to approve the OCBs, have the chairman date and sign.
Second.
Voting?
Aye.
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 Okay. Approve the bills for the month of July.
Motion to approve.
Second.
Voting?
Aye.
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 And we have the employee of the month from the appraiser's office.
Commissioners, I'd like to introduce Lisa Hardy. She's your employee of the month.
You got to come up to the microphone.
Just to come up and get her picture taken.
Lisa's been with us for 11 years now, last month, so.
Well, congratulations for being the employee of the month and appreciate your service, especially 11 years of it.
And you should be honored that you got the fence viewer of the month here with you.
Yeah.
And no matter whenever you run into her, she is always charming, happy, and smiling.
Well, appreciate that. Thank you. Thank you very much. All right, we're ready for Council on Aging's quarterly report. Linda? Good morning, Linda.
We're on schedule with our budget. There are no issues with our expenditures. Revenues are coming in well, so there is no problem with that. Do you have any questions about any of our budgeted items?
No, not on the budget, Commissioners. Do you have anything?
I
Well,
don't.
I noticed there's quite an increase in the wheelchair trips.
Yes.
Any reason for that? Anything
I'm going to speak to that in a little bit, but
you... All right, well, I'll wait then.
Okay. And then I'll just go over our statistical review with you. As Clyde said, our wheelchair has increased dramatically, and we don't know the rationale for that with people that didn't ride before that are riding now, or if there's just more people that are confined to wheelchairs. But this happened after we became strictly the Senior Express and transportation for the disabled. So it has increased, and we're very happy with that. We think we're meeting the needs of that population of people that really were intended to put in. So it's worked out well.
How many vehicles do you have that can serve wheelchair patients?
Well, that's a little bit of a problem because we just sold one on Purple Wave, and it was in such great condition, we got $1,550 for it. That was a handicapped vehicle. We have another one that the ramp, it's a hinged ramp, and because we're dealing with larger people and larger wheelchairs, the motorized ones, it has now broken the hinge. When we took it to have it assessed as to how much that would cost to have that fixed, it was $6,000. This is a vehicle that has well over 100,000 miles. And it's just makes no sense to put $6,000 into it. That's taking two right away handicapped vehicles out of our fleet. We did order the one that was approved, and that will take several months for that to come. So it does put a strain on us right now on being able to meet the needs. But I hope you agree, it just wasn't feasible to put $6,000 into something.
Right. I agree.
Probably isn't really, we wouldn't get that on Purple Wave.
There's a time and point when you need to either kick the car down the road for, you know. One thing I wanted to ask, since we have changed over from one position with the state, how is that affecting the people of the surrounding communities that really, they're not wheelchair bound, but they, like Senior Express, is it still?
Yeah, I'm not really sure, except I do know that Welcome Central is looking into applying for the 5311 grant to meet the needs of people that are not over 50 or disabled.
Right. Well, it's, to me, something like that is more of a concern for someone that would be having a bus route rather than handicap route. And I think that's why we got out of 5311.
One of the things we are going to do, though, this has kind of been an eye-opener on the lift, because we've identified those people that we believe that their weight plus the weight of their motorized scooter is such that it will break our equipment possibly, and we're going to put those on the big vans or buses right now. That poses a little bit of a problem, but it is doable.
Yeah.
And I did have our transportation supervisor look into what other things are out there that we have not been aware of. And we've located a van that they have now, which it's a ramp that goes underneath the vehicle and has a handle, and you pull it out from underneath and then lower it so there's no hinge.
Right. I've seen those.
And so we're going to look into that for the next one minivan that we get. I just think that would solve a problem, potential problem that might be there.
That would be a good solution to that problem.
Yes.
Is there any companies that rent handicap vans or lease till your other one comes in? Is that an option?
I don't know, Doug. We've never looked into
Well,
that.
look, if you're two down, that's as much as they get used. This is kind of critical, I think.
We certainly can look into that.
Sure, they're not cheap, but it would be a short-term solution.
That's in our budget right now to do that, but we're looking at all the ways that we can try to address the situation. The people that come first really are the people that are on dialysis.
Mm-hmm.
And so we want to make sure that we're able to get them to their appointment and back home again. And other medical appointments too, but dialysis, that's
Right.
for death.
Okay. Thank you.
Jamie, do you know anyone that possibly rents that type of van?
Not off the top of my head, but I'm sure we could look for some vendors out there that are in the area that might be able to.
Could I ask you to help Linda, if at all possible? Thank you.
And then our information and statistics, our numbers are down a little bit. And that has to do with a new employee in that position. And we've kind of moved over to another employee that does advocacy and counseling. So some of those numbers moved over there, but it looks down, and it is down a little bit. But I'm sure that this is going, as she gains confidence and we feel that, you know, that she can do this, we will see these numbers come up, I'm sure. And our nutrition, it continues to increase also. And we just really are not getting any complaints about our vendor. We feel like he does a very good job, and we're very happy with the volunteers that we have right now that deliver meals for us. And that's all I have on this statistical. If you have any questions about any of those. And then just a information review of what's gone on since our last quarterly report. We applied for a grant through the National Meals on Wheels organization for our PALS program, and we were one of 198 programs throughout the United States. We were awarded $2,500, which was the maximum amount that each organization could get. And the PALS program is totally funded by donations and grants, so we're very pleased to get that. This year we were allotted 125 farmers markets vouchers from the state. We have distributed all 125. And last year we were second in the state in our voucher redemption rate, and we were very proud of that. One of the things we do, and I think perhaps not a lot of agencies do, that have the farmers market vouchers, is we do make arrangements for our homebound to kind of give us a little shopping list, and then we send our in-home support staff, and they will go down and pick up whatever vegetables they would like and use their voucher. So that has worked very good. We had Senior Day at the fair on Friday, and we had the most we've ever had. It was, you know, a very nice day. We had about 381 seniors that came, and we're very lucky to have the businesses in the southern part of the county support us so that this is no cost to the county. All of our drivers attended the rural transit program training on coaching the van driver. We were lucky enough to have that to be a host for RTAP, and so our drivers didn't have to travel to take that training. An extension of our summer benefit fundraiser for Meals on Wheels was the flea market, and we had that at the Eagles. We raised $2,361. Also, this past quarter, we had an anonymous donor that, through a church, brought us $2,800 to use for seniors. So we were very thankful to whoever that was, and very pleased to receive it. And we had 30 fans donated to us from the First Christian Church for seniors that maybe had COPD or maybe just had a room air conditioner and needed a fan to kind of move the air around. We have placed our transportation sign in Tocanoxie. We've received approval from KDOT for that, and it's on 2440 highway, so.
I think these donations kind of speak for the service you provide. People want to support this.
Well, we're very thankful. This is a very generous community. We've been very, very blessed, and I think they look out for their seniors and those that really are low income or have other issues. I think the community wraps their arms around them and tries to take care of them.
Yeah, I appreciate that.
Any questions?
I have no questions, Commissioner.
No.
Do you have any questions, Linda?
I'm just very pleased with the report.
Yep. You know, always hear good things
That's
about
right.
Council on Aging. So appreciate what you do, Linda.
But it's kind of like, you know, sometimes we get complaints from citizens from different departments. I've been here 7 years. I have yet to have a complaint against Council on Aging, and I think that's there's just nobody complained because you give such good service.
Thank you very much.
Thank you.
Well, I got one this year, and it was off the wall. It was concerning your annual dinner. People couldn't get in.
That was a complaint from the chairman.
That was me.
He couldn't get in.
I couldn't get in. But that's good. We'll just find a bigger place.
That's a good problem to have.
That's a good problem to
Remarkable
have.
turnout.
Yeah, that was really supported well by the community. Thank you. All right, we're ready for emergency management.
Morning, Commissioners.
Good morning.
Do a real quick skim over of what transpired last quarter since we last met. Been fairly busy with several instances throughout the county. We've had 7 hazardous material calls, 2 of which involved semi-tractor trailers. One of the accidents was 158th Metro. Truck driver lost control of his vehicle, drove through the power lines, and it was a long, drawn-out deal with the power outages in the area as well as the truck itself. The driver was injured, but he refused treatment. The other one was the one that made the news, and that was the 2 semis and 4 vehicles on I-70, and that was a pretty bad scenario. My 40 years of public safety, that probably rated in the top 5 of the incidents that will stick with me for a long time. Had a gas main that was struck in the city of Basel. Actually, it was at a dead-end portion of the road, and the wind was in our favor, so no evacuation was needed in the area. Had an oil tank battery that floated ashore, if you will, during the big rain we had on one Saturday evening there just southeast on 231st Street. The oil tank battery, we find out, was empty, and the county shop was able to remove that, and a local farmer took possession of it going down the road and rendered it safe. Responded to a suspicious package on the south end of the county. Come to find out it was a weather balloon from Topeka Weather Service. They launch those balloons every day. And this gentleman's shipyard, he didn't know what it was. It had a baking light and everything else, and he was a little excited about it. And that's what we thought it was. Responded to Southern Star had what turned out to be a major gas leak. It was under the roadway at Dempsey and 235th Street, just a little west of that area. The weld joint had cracked, and it was actually leaking out from under the road, coming out the vent pipes. And it took them well over a month to make the repair when they went through that process. Responded to the Magellan Pipeline on 190th and Edwards Road, just south of that intersection, and they were putting in a new line. They'd already had the incident cleaned up. The farmer was excited that it might have caused contamination to his property, but Magellan's real good about their cleanup, and that was taking place. Had a large grass fire along the river levee. It was up there 159th and Hildebrand. We assisted 3 fire departments utilizing the UTV that we have, and then responded on 172nd Street to remove carbon tetrachloride, which is a result of an old fire suppression system that we had. It was up in the attic, so went up there and rendered it safe, and we were able to put it in the transfer station to get through that. Weather events, we've had a number of weather events this last quarter. 2 tornado watches, several severe thunderstorm warnings. The severe thunderstorm warnings, 2 of them caused damage. One was pretty significant, and when I say damage, it was mainly vegetation. We did have some barns that lost their roofs, and but we had one structure that had a tree go through it at Basel. Just happened to be my folks' neighbor's house that lost their roof, and it was a very large vegetation scenario. We were under 9 flood warnings. Stranger Creek, one of those warnings was as a result of that flood of Dawson Creek there behind the Country Care, and Stranger Creek that caused that tank battery to float ashore. Under preparedness reports, county fair's over, yay. We figured we outreached at least 2,000 people through our booth. We always find that a good opportunity to reach out to those folks, and it's always a good rapport when we have the folks presented there. Presented at the Leavenworth Police Department's Dare Camp, had over 60 children in various ages, and Kim actually presented to the Council on Aging and the youth at Christian Church of Leavenworth for weather safety. County staff continues to meet on the fall event on the south end of the county, and we're still working through those issues, and hopefully we'll be able to work through the traffic plan when it comes down. Participated in many meetings regarding the total eclipse on the 21st. We've had a number of conference calls. We've got another one this afternoon with the state. We're going to be utilizing within our office social media. The local media is doing a good job about covering various issues on their social media and what have you, but just on safety factors. The impact for Leavenworth County, we've checked the hotels and all the hotels are booked. Riverfront Park is full, they're booked, and State Lake is full with campers. So we're going to have an influx of people for those couple of days there, and other than giving them the services that they might need when they come here, I don't expect any other issues that's coming through. That's my partner, Mr. Miller, has heard everything other than that. Exercise and training, attended an exercise, statewide exercise for the Kansas Incident Management Team. It was held in Emporia. Outcome of the exercise was a continuation from the one that was provided in Salino, one putting up an emergency operations center inside and then moving one to the outside as an alternate if that ever happened, assisting Lyon County through the incident management teams. I'm currently serving on the Marks exercise planning team for a recovery exercise. We always do an exercise on response, and we never do one on recovery, and that's been my biggest pet peeve, if you will, within the metro region when we do these big exercises. We never think about what's going to happen after the fact. So that's what this exercise will be based upon, and I'm excited for its outcome. I talked to the county administrator. We've been, I say we've been tasked, but all of the agencies that provide care for Medicare or Medicaid has to provide a plan, and they also have to have an exercise of some sort to meet the federal guidelines. Well, we're starting to get hit with various agencies, and we're talking about dialysis folks, urgent care, long-term, short-term facilities. And it's always been required for hospitals, but now it's being required for these even doctors' offices. So we had our first one with the Eastern District Care. It went real well, and we used the tornado hitting the facility. Presented Westar reference weather safety. That went real well. They'd like for me to give it to several other of their agencies. And the other one was participating in the VA park to exercise the privately owned amateur radios operations. They run for 24 hours straight. Representative Pittman was actually up there, and he made contacts somewhere in Alabama, so he was excited about that. Under planning, we are moving rapidly to replace through our siren projects. Right now we're working through the permit process and notifications to make sure the project goes smoothly when sirens arrive here in about 6 to 8 weeks. And the last thing, we still have to take board approval for me to continue. If you recall, back in January, I put in a letter of intent for the acquisition of properties for a mitigation project. And we still have 5 parcels throughout the county from leftover from the 93 and the 98 flood, the 2005 flood that are continually flooding. in those areas. Those folks have actually, in 2010, had expressed an interest that they want to be in, but funding has never been available through the mitigation project. Put in a letter of intent. That letter of intent came back as of 28th of this month, or July, saying that they've accepted our letter of intent and that we could proceed with the project. The project for Leavenworth County was $465,000. FEMA's going to pay 75%. 25% of that will come from the county's responsibility. That could be an in-kind or hard match. So in short, we're looking at about $115,000 that we would have to come up with an in-kind and or a hard match. Commissioner Smith, if you recall, in the 98, county shop was able to provide our in-kind match in making the demolition. That's what I'm hoping that we move forward with this, with that same project, with that in mind. If not, it still has some funding left over from that would take that down to about $75,000 that we would have to.
And would we be able to use county forces and just charge a FEMA rate per
Yes.
equipment hour to get our in-kind rate?
That is correct.
Okay.
And
Or we
even
could
if
just
was-
bid it out and
Exactly. We
then
could
pay
bid
the
out that
contractor.
contractor and do it as well. So either way.
Either way.
We can do that. So I guess what I'd be asking is permission to move forward with the application process since we were accepted. If that's something that the board would like to.
I would move that we authorize the application process.
Second.
Voting.
Aye.
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 And I did communicate this with the county administrator.
Okay.
The emergency preparedness performance grant is well on the way. We got the new guidelines for 2018. And as far as my budget, it's shown that I've got about 34-35% spent already. That'll go away when we start paying for different contracts in the future. That's all I got, commissioners, unless you have something else.
I wanted to ask one question. The unfortunate thing that happened out at the industrial site that's being developed, were you involved in any of that?
Didn't know nothing about it.
I was kind of wondering because I don't know if it made the newspaper or not. It happened while I was gone, and I've heard about it, and I was just wondering if there's maybe Jamie could answer. You can't answer on it either.
Not without divulging information, Commissioner. That's not something that I can answer in open session.
Okay. I did talk with one of the relatives of the deceased and yesterday, and very unfortunate. And I think it's preventable if people know about it and people can just use common sense. Thank you.
You talked earlier about you having to develop a plan for people who are on Medicare. Is that throughout the whole county? You have to have a list of people who are on are on dialysis and stuff like that?
It's the facilities.
Oh, it's just the facilities. Okay. I thought
And
maybe
I
it
don't
was.
have to have a plan. They have to develop a plan, but in the wording, it says contact your emergency management agency for assistance.
Oh, okay. I thought you was going to have some plan in case there was a disaster in the county that you had to see that these people
Well, and that's what the facilities are supposed to
Okay.
be doing. And when the county administrator and I met one-on-one, we had that conversation. And as Mark said, it's really not our responsibility to write their plan, which it's not. But we want to make sure that whatever they're writing and planning goes in concise and marries into county's emergency operations.
You will look at their plan then?
We will. review.
Okay, all right.
And we can give them guidance as far as exercises and ask them to participate in various exercises.
Okay, all right. I was going to say, that's pretty big task that
Yes.
you would have to do.
And it's a big task even with the facilities.
Right.
It's-
Yeah.
There's so many of them out there that we're not aware of.
Okay. All right. Commissioners, have any more questions? Mr. McGaha? None. Thank you, Chuck. Mr. Miller?
Morning, Commissioners.
Good morning.
Prepared two quarterly reports for both departments. We'll start in the health department. As you can see, expenditures are on track for the first half of the year for the health department. Again, some of those expenditures are also the end of the year because we're also on state fiscal year grants, which push some of those expenditures a little high, but we are on track at 46%. We could be up to 50%, but we're on track at 46. We're also on track with our user fee collection. We're at 51%. We also had just a report I signed this morning. We had a good month for July, so we're about 60% for the first 7 months. So we're on track with user fees. We're on track with grants received for the year thus far, and we just started again the new fiscal year for state aid to local grants. So I don't foresee any issues currently. As you can see, total revenues collected, 785 to our expenditures. We're on track. Statistics, again, I always prepare the board that they appear low. We were at our lull for the second half, but over the last 2 weeks, we've been averaging about 50 clients coming through per day. And that's because of school immunizations and things of that nature kind of happening. So that third quarter is kind of where we catch up in our numbers. We are anticipating lower numbers in WIC, but that's not localized, that's statewide. There's some lower numbers, and we're a little ahead of the average, but we're going to see a little bit of decrease in our numbers in WIC. As you can read through the items to report, the biggest items I just want to kind of highlight on, we have filled our public health nurse position, and that person is working very well and up and running. But with that, we just lost our lab technician, went out on maternity leave, enjoying her baby and does not want to come back. So that position is out to be refilled. One of the other last items that I didn't have on here because I didn't have a whole lot of information until this week, we're working with the safety committee to put together health assessments and flu shots like we've done in the past. But those have been not well received or well attended here through employees coming to us. So we're looking to add to those potentially. And one of the things that I've discussed with Mark is adding a stroke screen along with that, which is some sonography and things of vessels and things of that nature to help. And there's a cost associated, so we're exploring that. To see if that's something that the safety committee, as well as maybe benefits and such, can do part of this to get people in. So we'll have more information, but I just kind of want to brief the board as we're going forward. We will be back with some more information once we have all of that information. But again, working with the safety committee as well as Mark, and I don't know if you have anything you want to talk on that. But
The stroke screen's a program that I've utilized before. Over in Raytown, we brought it in for as part of our health fair, and in meeting with the people who actually do the screening and a discussion, they said they do this every day. It's what they go out and do these in different facilities, and they said without fail every day they identify a person who needs to follow up with their doctor because of just indicators that they are at risk for a stroke. So if you can do that for just one person, who in this case would be an employee of the county, it's worth whatever money we're spending to bring them in and conduct those screenings. And it had the unfortunate result of one of our aldermen actually passed away of a stroke about 2 months prior to us having the screenings done. So they're worthwhile, and I really support Jamie in this and hope we can make arrangements for it.
I agree.
Jamie, why is the WIC program tending down?
From the information that we've gathered from, birth rates are down currently, and there's a nationwide decrease in numbers into the program. We haven't seen the nationwide percentage in drop as much as other areas have. And matter of fact, when they came out in March to do our audit of the WIC program, they actually identified that we're ahead of that percentage of drop. And they actually increased our budget to cover some more costs and to do some more things because we are doing better numbers than other areas and such. So they were able to take some funding from other areas and push it to us. So we're going to see a little bit of increase in funding in our WIC than other areas in the state and some other nationwide areas that have really seen a decrease in the WIC program. So to answer your question as to what specifically, we have some of that data I can give with Jody if you want something specific, but we do know birth rates are down and some of those type of things have impacted. Anything else on health department?
Sure you'll be having flu clinics before your next quarterly report? I mean,
That will be part of the health assessment, health fair. We're
Okay.
trying to put that all together, so kind of a
okay.
one-stop shop. So if we can get people to come out, we can do everything at once. So if they're going to interrupt their day and come out to us, we kind of do everything at once.
Okay, all right.
So, well, I'll be back in front of the board to talk further
okay.
in regards to the health fair and assessment of what we want to do and how we're going to do it and when and so on and so forth. Anything else? Health department?
I don't have anything.
Thank you.
Move over to EMS again. We're at 46% on expenditures for the budget. So we're doing well there. Again, user fees, we're at 57% for halfway through the year, so we're doing well also on our revenue. As you can see statistics, and I have a run comparison below with some projected 2017. If we continue down this path, we'll be into the 12,000 range of call volume for the year, as well as 10,000 with patients and over about 8,600 if we keep on the path that we are. Response times on page 3, again, it just kind of gives you an outline. This is nothing new, just keep updating numbers for you. Average response times, calls per week, calls and right on through. Maintenance budget, we're at 36%. Reminder how the makeup is of the 190,000, that's fuel, parts, and labor and maintenance into that budget. And again, with fuel prices being down, that keeps that budget under control. We've had really no significant maintenance in the second quarter that we really have to discuss. Trucks are busy. We have received in 9114, which was at the second remount. Ambulance has come to us. It's in service and in the fleet, so we're to 8 trucks now within our fleet. So we're seeing that help by rotating trucks and not putting all the mileages on any specific ambulance. The last down on page 5 is kind of a cost per mile. That's kind of what I track. I want to know what ambulance needs to go out next, what ambulance is costing the most. The orange is specific to 2017. The blue is the overall of what that truck per mileage has costed since it's been in our fleet. We should see that pretty linear across the board. And in the orange, we will see the spikes because that's where we start to see the older trucks costing us more as maintenance goes up and we start having problems with those. As you can see, we have 9117. We're having a door lock issue with that truck right at the moment, and it's currently over at Westfall being looked at for that. So those are where some of those costs come in. They're clear up in the 190, 200,000 mile range, and we start to see higher maintenance costs for those trucks. Items of discussion, just an update on the image trend software. That's our patient care reporting software that we switched to. It shows in here that July 28th they were going to be shipped. We were able to get them shipped earlier. They were delivered to me as of Tuesday, so we will be putting all the software onto those. And hopefully, I have a rollout and a target date of October 1, after we get through all the training to make sure everything's up and running, of a go live date. So we're really starting to get on track and have some, now that I have the laptops, the new laptops in hand, we'll be able to move forward with that. The 4 staff vehicles are on Purple Wave. They will, the auction will end on August 8th. I checked this morning before I came over, and on all 4 of them, together, they're bidded up to $14,900 right now for those 4 vehicles to go out. And I anticipate as it gets closer to the end, that will go on as well. So I think we'll get money back, well spent on putting on Purple Wave versus trading. And the last item, during my monthly meeting with Mark, I discussed with him the paramedic sponsorship agreements that we send EMTs to school for paramedic schooling. And in return, after they return, they stay with us for 3 years. And the cost that we provide for them to go to school is then on their end basically relieved. And we talked about those contracts, whether they still need to come in front of the board, or if I need to do something different with him, or with them, excuse me. And I'll kind of turn it over to Mark for that conversation of what we were discussing.
Yeah, these agreements, you may all be aware of them, but basically they bind that employee for 3 years, and if they leave and go somewhere else, they have to reimburse us for the expense that the county laid out for the training. Almost every entity uses these now because of the expense training the employees. And my discussion with Jamie was that because these are a very regular occurrence, and they're not binding the county to anything, they're binding the employee to us. I'd like to see that if the board would be acceptable, just to allow Jamie to sign these on his own as part of his everyday functions of his job. I've discussed it with the county counselor. He says as long as the board's okay with it, we should be fine.
I don't see a problem.
So you need a motion?
If you could.
Motion to approve that Jamie signs the paramedics agreements.
Second.
Voting?
Aye.
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 Thank you.
That's all I have, unless you have any questions.
No. Thank you, Jamie.
Thank you.
We are ready for, you said Mark had asked for an executive session.
Morning, Mr. Chairman, members of the commission.
All right.
Commissioners, David Van Paris, I've presented you with a proposed motion language for an executive session for the purpose of attorney-client privilege, stating the purpose, the subject, and that present would be myself, Mr. Lawfrey, and the 3 commissioners. Be for a period of time not to exceed 30 minutes. I've left the time open as to when you would resume open session in this room.
Okay. Okay, I'd like to make a motion to go into executive session pursuant to KSA 75-4319B2, that this body recess from regular session, go into executive session for the subject of the consultation with the board's attorney, David Van Paris, for privilege of client-attorney consultation, and for the purpose of protecting and preserving the attorney-client privilege of that to be discussed. I would further request that such motion provide that period of executive session be for a period of time not to exceed 30 minutes, and the board will go in at 9:45 and resume at 10 in this room in regular session at 10:15. Those present would be the 3 commissioners, Mark Lawfrey and David Van Paris.
So moved.
Second.
Voting.
Aye.
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 Let the record show we're returning from executive session into regular session at 10:15. No decisions were made, and the subject was, we stuck to attorney-client privilege.
Mr. Chairman, I would make a motion that we instruct the staff to proceed with the necessary steps in regard to the topic discussed.
Second.
Voting.
Aye.
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 Anything else?
Gentlemen, appreciate your time this morning.
All right, motion to adjourn?
So moved.
Second. Voting.
Aye.
Aye.